Namaste everyone, I am Dr. Amit here. Welcome back to my YouTube channel at the rate Dr. Amit Official, your place for simple and high impact medical learning. So if you haven't subscribed yet, make sure to hit that subscribe button and stay connected for more such videos on every subject from MBBS. So in our last video, we discussed from our microbiology series about Clostridium botulinum. So in today's video, we are going to focus on an important gram-positive bacteria called Clostridium perfringens. So this is one of the exam favorite topic for NMCLA, USMLE, PG entrance exam and MBBS professional exam. So I'll explain this gram-positive bacteria in a simple, clear and exam-oriented way so you can understand it easily and tackle all the MCQs from this topic. So stay focused and let's start our today's topic, Clostridium perfringens. So Clostridium perfringens, okay. So talking about the lab feature of Clostridium perfringens, it is a gram-positive bacteria, anaerobic and spore-producing bacillus that is rod-shaped. Now, where Clostridium perfringens found? Okay, so it is found in soil and human intestine. Now, why this Clostridium perfringens is important? Because it causes major disease, okay, called gas gangrene, which is very important and most often asked in the professional exams and in MCQs in the entrance exams, okay. So it causes gas gangrene and food poisoning, okay. Now what's the valence factor in this Clostridium perfringens, okay. So alpha toxin, it is also called as lecithinase phospholipase C, okay, present over here, okay. So while talking about the pathogenesis, how this toxin causes gas gangrene or food poisoning, so let's talk about the pathogenesis, okay. So suppose trauma occurred anywhere, suppose in an RTA, road traffic accident, or during surgery or in any war, okay. Then from that trauma area, spores enter the wound, and we all know it's an anaerobic bacteria. So in that anaerobic environment, the bacteria starts growing, okay. So the bacteria grows there and produce a toxins called alpha toxin, okay. Now what happen is, so this toxin has been produced in the wound area in the anaerobic environment. Now that toxin causes myonecrosis, it means muscle death, it destroys the cell membrane, it causes hemolysis of the RBC, okay. And this toxin also produces carbon dioxide plus H2, and this carbon dioxide, the carbon dioxide produced by this toxin causes tissue crepitus, okay. You'll feel a crackling sound when you'll press the wound area, okay. So tissue crepitus and swelling on the wound, okay. So that's why sometimes also in MCQ we give a tissue crepitus, okay. So always remember this tissue crepitus is because of the carbon dioxide produced by that toxin, okay. Now talking about the clinical feature, okay. So clinical feature is severe pain. In the wound area you will get severe pain, okay, swelling, then foul smelling discharge from that wound, okay. Then gas in crepitus, which gas? Carbon dioxide below over there, okay. And that wound will be in rapid progression, okay, rapidly it progresses, okay. So this is all the clinical feature. So let's remember the clinical feature from this figure, okay. So we know severe pain, okay. So just look at the face of the patient, okay. There will be severe pain, okay. Then there will be swelling, okay, swelling in the wound area. Then from the wound there, foul smelling discharge is coming, okay. So foul smelling discharge is there, okay. Then below the wound there will be gas, okay, and that is cause bubble pop, okay. So gas in crepitus, okay, and at last it causes myonecrosis or a muscle death, okay. So this is just remember this figure, okay. Just keep this figure in your mind, and it will help you to remember all the symptoms of caused by the Clostridium perfringens. Now there is a term called spontaneous gas gangrene, okay. So remember the organism Clostridium septicum, okay. So it causes spontaneous gas gangrene, okay. So it goes via hematogenous spread, okay, I mean from blood, and associated with colonic malignancy, okay. So this is an extra point, okay, remember this. Now we all know that this Clostridium perfringens causes gas gangrene and food poisoning. So we talked about gas gangrene and food poisoning, okay. So suppose if any food, okay, any food that has been cooked and left, okay, you suppose you made a food and you left it for some time, okay, and if the food is heavily spore contaminated, then the spore will start germinating in that food, okay. Then when you take that food, it is considered enterotoxin. Okay, it will infect your GI. Then you will have a food poisoning symptoms. Okay, but the thing is, it will the symptoms will get resolutions in 24 hours. Okay, so this is about the food poisoning caused by the Clostridium perfringens. Now, how we'll diagnose the case of Clostridium perfringens? Okay, so like other Clostridium species, okay, um, they are also diagnosed mostly clinically, okay, based on the clinical presentations. Okay, and if you'll do the X-ray or CT, then you'll find gas, okay, that is present in the tissues. Then if you'll do gram staining, then you'll get gram positive rods because it's a bacillus. Now coming to a treatment part, okay, so this is a surgical emergency condition. Okay, so immediately you have to do surgical debridement or amputation. Okay, then to treat the bacteria, we need to give antibiotics that from penicillin group, clindamycin. Okay, then we can also give hyperbaric oxygen, but this is optional. Okay, this is not we must have to give, it's a optional that we can give hyperbaric oxygen. Okay, but always remember it's a very surgical emergency condition. Okay, so immediately we need to debride the wound and amputation may be needed. Okay, and in case of food poisoning, we all know that it causes gas gangrene and food poisoning. In case of food poisoning, we have the symptoms will be watery diarrhea, abdominal cramp, but no fever usually. Okay, and it's a self-limiting. I have already told you that the symptoms will have resolution within 24 hours. Okay, so in USMLE you will get a clue in the questions. Okay, like double zone of hemolysis on blood agar. Okay, then always think of Clostridium perfringens. Okay, so I think this is all about Clostridium perfringens. Okay, you can go and solve the MCQs. Okay, for USMLE, NMCLE, PG exam, or any entrance exam. Okay, so this is all about Clostridium perfringens. So if you like this video, please do like, subscribe my YouTube channel at the Dr. Amit Official, and please share with your fellow medicos. And we'll meet again in the next video on a new topic. Till then, study hard. Thank you.